Hi everyone. Today we bring together three incredible women making a difference through healthcare, science education, and community outreach. Joining us are Sister Allison Andrew from Mediskills Academy, Kerusha Pillay from Helpful Scientist, and Janice Benecke from PinkDrive. Let's explore the power of collaboration, awareness, and service in transforming lives. How are you?
Oh,
We
good.
we good, we good.
Thank you for having us.
You're most welcome, and it's a pleasure to have you all again. So I'll pose this question to all of you all. Uh, how is collaborating together strengthen the impact within communities?
Go.
Well, it's a big strength because normally if Pink Drive goes, we do the breast examinations and education and one-on-one with the nurse. We can also do blood pressure and glucose, but we've got Sister Allison and her team that come with us. And so then there's more nurses and more people can get helped in one day. And then we've also got a very informative gut talk and other talks that Kerusha does. So it's really nice. There's a whole lot of mixture of services that the people are getting for free.
For me, the collaboration is so important because remember, we're all bringing our skill sets into this. It's us from the medical part. Janice is so well versed with everything. You are cancer related. So, it's awareness. And with Kerusha, she brings expertise to this. And remember, the people that are coming to this event, it's not just for the wellness itself. We are so lacking in education. Most people, it's purely lack of education that they don't get treated. Karusha, what do you think about that?
Oh yeah, Kerusha needs to unmute herself.
Kerusha?
Oh no, Kerusha, you actually muted yourself again.
Sorry about that. Can you hear me now?
Mm-hmm.
Can you hear me now?
Yeah.
Okay. I absolutely agree with Sister Allison and Janice. The collaborations that we're doing together, it's so important because in order to take care of humans, you have to remember there's an old saying that it takes a village to raise a child. But that same child, when they get older and they need help, a village also needs to show up for them. So Sister Allison and Janice and Pink Drive and Mediskills and Helper Scientists and all the other organizations that we get to collaborate, it allows us to go out as a village and to allow people to get the opportunity to take care of themselves. And Sister Allison and Janice are the warriors. They are the lead warriors. I'm just here as a cheerleader, and I get to be. It's an honor to work alongside them.
Awesome.
Thanks.
Uh, all right, Alison, what have you learned from working alongside professionals and organizations focused on both healthcare education and cancer awareness?
Look, before we started joining with Pink Drive, collaborating with them, it was just our singular tests that we were doing. Now,
Mhm.
after we've joined with Pink Drive, we place a lot more emphasis on awareness, on early detection, and that's very very helpful in our field as well. We're saying to them, get treated before it gets to a point where you can't be treated. So Pink Drive, and as with Karusha as well from Helpful Scientists, I know gut health. I've learned a lot from Karusha.
Mm.
Gut health is so instrumental in a person's well-being. If I can say that, Karusha, I may not be saying this right. It's so fundamental in starting up and living healthier lifestyles. And with Janice, also with our students that come along, Pink Drive gives them enormous opportunities to learn. And I think each one leaves from my course, having learned so much more than they would from me, from Janice, because Janice is brilliant. She teaches them things, and it's true,
Sure.
they learn a lot. And again, awareness for me is the most important thing. By the time they get to Mediskills, sometimes it's too late. They need to be aware of what they have. And Janice teaches my girls that, and oh, we are grateful for that.
Yeah.
And Karusha, thank
Awesome.
you as well, Karusha. I know my girls are always with you and they're learning stuff, and that's important. That's a knowledge that they're taking out into the communities, taking out to their patients as well.
And what better way for the nurses to learn than to be there, and to do the PSA test, that's prostate and testicular test, and to do the breast examinations, taught properly, because that just comes as a bonus for them.
Absolutely.
And it's very good for their CV as well, so they can put these extra services on that they've learned.
Awesome. Kerusha, what role does public education play in helping communities better understand preventative healthcare and early detection?
So it's absolutely important. In our current environment, we have to remember in South Africa, we're facing multiple layers of issues. Not every single area, group of people, population, whatever, is experiencing the same things. On the same street, people are experiencing different realities. So before we get to the point where we're diagnosing people and we're telling them they have cancer, they have stroke or heart attack that are related to high blood pressure, for example, we need Sister Allison and Janice out there to educate the public on how to take care of themselves, what to look for. We don't want patients to end up at the doctor hearing that they have stage 3 cancer. From what I understand, 56% of the women that show up with cancer, they're already stage 3. But we could have done something if they had learned Sister Allison's method, if they had seen her. I'm sorry, Janice's method. And if they had been to Sister Allison's team, and they have such a lovely team of people willing to take care and look after you, just to find out what your blood pressure is or your glucose, or just to get the conversation started. Sister Allison pointed out in her last talk that not a lot of people have ever been screened. And, we're talking about people who are quite elderly. And it's the first time they get to be screened because of initiatives like PinkDrive and Mediskills. So it's absolutely important in our environment, and it's a necessity. If we don't have the luxury of saying in our country that it can be the government's problem, it can't. We have to help wherever we can. And this is the way to do it. And collaboration is at the heart of everything we are doing to make sure that people will come out and not just say, oh, we're coming out just to see a PinkDrive. We're also coming out to get our blood pressure checked up. And, these kind people, Janice's team and Mediskills team and even my team, it's a lot of loving, kind people who are there to listen and to build a bridge to help. Because sometimes it's very difficult to get onto that road and to prevent things. I often see it now that I'm in the field, especially with the initiatives I've done with PinkDrive and Mediskills, is that people don't want to admit it even exists because they don't want to bring it into their world. But sometimes it's already there, but they don't want to admit it, and therefore they won't get help, and they want to continue. And so we need to be able to show them that there is a village that cares and very much would like to help.
Awesome. Janice, what are some of the biggest challenges communities face regarding awareness and access for early cancer screening?
So I feel that, a transport has got a lot to do with it, because some people have to walk literally miles and miles and miles to get some help. And then you get PinkDrive that comes along and drives right up to them. And also, they don't really like to have their, let's use pap smear for an example, done at a clinic, because especially if it's staff that are at the clinic, because we can also help them if they're not on medical aid, okay? And then they don't want to have it done because then the other staff members will see, that this test has come back and there's a problem and whatever. And so we find those type of things as challenges. But I do feel for them, because they do literally have to walk for miles and miles and miles. And then when they get there, they've got to wait in that queue for hours to get seen to. And then if it's like for a mammogram, like the machine could be broken or the radiologist isn't there. And then they've got to wait months for their reports. So I find those type of things as challenges.
Okay. Mr. Allison, in your opinion, why are partnerships between community healthcare organizations so important in South Africa today?
Let me be very, very honest with you. I'm going to do an early new. Our healthcare system in South Africa is horrendous. It's awful. We lack resources. Firstly, uh, we South Africa comes with a myriad of challenges. Firstly, the resources, lack of it, absolute huge lack of resources. You know, our healthcare infrastructure is so crippled, and it takes a huge strain on them. Like Janice was saying now, sometimes they go to the clinic, they've got to wait an entire day, having not been seen to, and come back on the next day. That's where you guys obviously, with you as well, Kerusha. I mean, going to a dietitian, it costs a lot, and people don't have that kind of money. So with these outreaches, for me, it's so impactful because people are getting these services to them for free,
And they get the results same time.
Absolutely.
Unless it's a pap smear. If it's a pap smear, it's got to go to a lab. And that takes between we give say 2 to 3 weeks, but just in case the lab is busy, and we give it to them within 2 weeks. So we will take the results to that sister, and the sister will then in turn give it to the patient.
And you see, when we have partnerships and collaborations like this, we all are putting our skill sets together. People are getting maximum benefit. And also, when we have these collaborations, we're also not duplicating. We know the areas that's been served already. So PinkDrive is not going to go there on their own steam. And then a week later, Mediskills, and then a week later, Helpful Scientists. We go as a team to the underserved area where there's a need as an entire team, go there, get them done, and we out. So these collaborations help for that.
They're very powerful.
Absolutely.
Lovely. Kerusha, through your collaborations, have you noticed a growing public interest in combining science communication with real-world healthcare support?
Yes, absolutely. As we've been going out into the field, you can see that people want to learn and that there might be a barrier to wanting to understand sometimes. And so as we're moving out into the field, we're seeing more and more that people want to own their health. Actually, a very interesting statistic I read this morning was that 92% of South Africans, they recognize the importance of actually taking care of their physical and mental health, 92%, whereas in European countries and America, only 81% of people recognize this. So that doesn't mean, it shows that South Africans want to move in the right direction. We understand it, but we need the support. And so what we're seeing through these collaborations is that people want to engage and want to think beyond just being diagnosed, oh, I've got the disease. They want to help themselves before they get there. They want to talk about these things. So in providing safe environments where people can talk about these things, we can move the needle on all the various issues that we have. South Africa has a quadruple burden. This morning I thought I was going to say it was a double burden, but we've got quadruple burden in the fact that we're dealing with HIV and TB on its own, and Sister Allison and them test for HIV. We have the non-communicable diseases like heart attacks. We've got all
Wow. So did
Okay.
Kerusha freeze there?
of the other ones that
Oh,
fall in
okay.
there, like diabetes. Okay. Yes, and then we've also got, so on top of the TB, the HIV, we've got diabetes and your non-communicable diseases like heart disease and obesity. But we also have high maternal and child mortality. And then the fourth one is trauma and violence. So that's a heavy burden for a country. And we obviously don't have the resources. We have a critical shortage of healthcare workers in the field. So because of all of these factors, collaboration has to be there. And it's a necessity, like I said before. And we're seeing as we're going out into the field that people are more responsive to us as a team or as a village, because honestly, the three of us just care. Like we hang out on a regular basis and we're just human beings that truly care, which is why I love being part of these collaborations. Because as much as people think that the world is a dark place, when you have people like Janice and Sister Allison who show up and want to work and want to help people, and they're just doing it from the kindness of their heart, it makes you have hope. that there will be solutions.
Beautiful. Janice, how powerful is it when healthcare outreach, science and education, and cancer awareness come together under one shared purpose?
Yeah, it's just impacts on the people. Um, I think, like we said before, there's no separate services. Under one umbrella, they're getting all
Yeah.
their services done.
Yeah.
It's no back and forth for them.
Okay. All right. Allison, looking ahead, what kind of collaborative projects would you love to see between Mediskills Academy, Helpful Scientists, and PinkDrive?
Look, I'll answer from my end. I'd like to see bigger outreaches, reaching more people, making more people aware, more free services offered to them. Right now, we're limited, as you know, we're an NPO, as a Pink Drive. This weekend we had an outreach at Asheville, and most of our equipment was stolen. So, we've got to build up stock again. And, your question, we want to reach more people. I know Kerusha as well, she's an NPO, as is PinkDrive. And we'd like to reach more people. I mean, that's for Mediskills. We'd like to do bigger outreaches. I'd like to be able to target the youth. That's where it starts, the kids at school, the senior, cancer awareness about their health. Because again, like I said, sometimes when they go to a clinic, it's far too late. We need them to be aware. So bigger drives would be absolutely amazing. Bigger outreaches, more collaborations with other companies. How do you feel about Janice? What do you?
Well, I'm going to be answering the last question in this one. We would love to have these bigger outreaches and things like that, but this does cost money. And we cannot do all these free services without help from businesses and corporates and fundraisers and
Absolutely.
cupcake sales, even at schools. There's so much that you can do so that we can continue doing these services, because we can't do it without money. And like Sister Allison said, all her stuff has been stolen. So she's left with nothing. She's got no blood pressure machines or glucose machines and strips and whatever have you. So it's going to cost money or a sponsor to replace it for her, and even for us. I mean, there's costs involved. There's nurses that has to get paid, and there's petrol and the stuff that PinkDrive use, there's creams and lotions and kits and all that type of thing. So we appeal to big corporates and places that can afford to, even I've got one lady that gives us 200 Rand a month.
Wow.
200 Rand a month, every month, that money comes in our bank. And some people even give 50 Rand. Do you know all those 200 Rands and 550 Rands? Do you know how they add up?
Absolutely.
That add up to me doing another free clinic. So if there's
Wow.
anybody listening out there that want to sponsor PinkDrive or a Mediskills or Helpful Scientist, please feel free
To reach out.
so that we can all continue doing it, because there's a cost to everything.
Kerusha, what excites you most about working with organizations that are directly impacting lives on the ground?
Currently, 80% of South Africans are not dealing with the issues. What excites me is that when we do get together, I know we're going to bring those numbers down. I know that we can help move the needle, and other organizations that are on the ground as well, they are also getting involved. And there's so many humans out there that want South Africa to be a healthier, happier place. And I know through these organizations and these collaborations that we're going to make it work, because that's what South Africans do. We get on with the job and we do what we need to. So I'm looking forward to a healthier future, and I'm looking forward to much more collaborations and events where we can make actual changes and people are empowered to take the responsibility for their lives and to help themselves.
All right, Janice, I think you did touch on that the last question, I think, but you can probably give it in a nutshell again. What message would you like to share with business and individuals about supporting collaborative healthcare initiatives in South Africa?
We would need funds, okay? That's the main thing that we need, so that we can do our free services. And it's very difficult to do it with, without people getting sponsors, but because PinkDrive can't pay for everything. They can't pay for me to do 2 free services or 5 free services a month out of the money that they're collecting, because we're trying to get an HPV truck that can go all over to do those tests, and so we really need help. I mean, you can have a cupcake sale at a school. You can go out and say, okay, let's everybody put 20 Rand in a bowl for PinkDrive, or a school can say everybody can wear pink and pay 10 Rand. And those things all add up. Spray your hair pink, you know what I mean? There's so many ways that you can raise funds for us. And I know times are hard now, okay, and every cent counts. But 5 or 10 Rand at the school for PinkDrive, and you've got all those scholars there, that makes up to maybe, I don't know, a few thousand Rand. That could, because a mammogram, if you go to the private sector, is around about 2,300 Rand, okay? Now, PinkDrive can do those for free if they get money from the public, and we don't charge, it doesn't cost us like that. But we have to cover the costs of obviously the truck getting to these rural places, and you can't just pitch up at a rural place. There's a whole lot of things that you have to do. You've got to go and view the event, because you can't just take your truck down a road that's going to go, like that, because there's sensitive equipment at the back.
Absolutely.
So there's so many things that it's all costly. So it all comes down to funds, really. But we do PinkDrive do pay for me to go and do free clinics during the month, even if we haven't got a sponsor. But we really need to, because we can't take the money away that we are trying to get for the trucks and for the services that are done at head office,
Absolutely.
Cape Town and Pretoria.
All right, I'll get to the quick comment questions here. This is the first one here is from Reshton. Hi all, I love the collaboration and dedication. Thank you. Is it voluntary or does the government fund the project?
Okay, so the government doesn't give us a cent.
All three.
Not all three of us, not a cent. So nothing is, it all relies on sponsors and corporates and donations. The government don't. Nothing.
Look at Mediskills itself. It's mainly self-funded and sponsorship, which, like Janice said, if we don't have that, there's no way that we can continue. And we'd love to reach more people. We're passionate about what we do. We love our work. I know Kerusha will second me on this. We love this. We love reaching out to people. But, with funds being so limited, it
and
hampers.
The diabetic strips and cholesterol strips are extremely expensive. And they do about 80 when they're with me. So no help from anyone.
Okay.
In the government sector.
Especially the
Kerusha, okay. Kerusha, would you like to add to that?
From my side, health scientist, because Nomandla and Itemba, all of them have always been funded on my own. And so I've tried to help from my side. So funding is not something that we've gotten from anybody, but we show up because we care.
Of course. All right, I'll get to the last comment here. This is from Bhavani Governor 7428. Sister Allison and Mediskills have been absolutely amazing in assisting our communities and educating and giving our elderly and frail much needed medical care by doing their BP, sugar, and HIV testing. I don't know if you know this person here.
Thank you, Bhavani, for that. Like we said, we're passionate about what we do. We love what we do. We really do. And thank you for appreciating us.
Yeah, because our work is not a job. You've got to have that passion in you to like be happy to wake up in the morning and go to work. It can't be like, got to go and do this.
Absolutely.
Because our jobs are different. It's every day is different. We meet people nearly every day.
Definitely.
Thousands,
Yes.
hundreds
Oh.
of thousands of people. And I'm walking around and someone will come and say, hello, Janice, or whatever. And for the life of me, there's no ways I can remember all your names. But thank you for appreciating all the work that we do. We're doing it from our hearts. And
Absolutely.
that's not just something to say, it's the absolute truth.
Awesome. All I got to say is thanks so much for your time, and I hope to catch up with you all once again.
Thank you.
Thank you for having us.
We're twins
You're
here.
most
See?
welcome.
Yeah.